effective poverty alleviator in the country. In 2017, SNAP lifted about 595,000 Latino children out of poverty. While Latinos have a higher labor force participation rate than the nation overall, SNAP remains critical for Latino families struggling to make ends meet. According to a recent poll with Latino Decisions, Somos, and UnidosUS, more than 60% of Latinos are concerned about being unable to keep up with basic expenses, such as food, because of layoffs or pay cuts due to the pandemic. Next slide. In addition, the pandemic EBT program is another important tool that gives families who have lost access to free or reduced price meals due to school closures with benefits to purchase healthy food. This program is crucial to help fill school meal gaps for Latino children. According to our poll, about 60% of Latinos are concerned that their children or close family members will have trouble accessing free or reduced price school meals. Our colleagues at FRAC will discuss further about the recent changes made to pandemic EBT, but I do want to emphasize that pandemic EBT is excluded from the public charge test and that all children and families should not worry about pandemic EBT impacting their immigration status. Next slide. The Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC, is another important tool for millions of low-income pregnant and postpartum women, infants, and children. It is estimated that more than 40% of all WIC participants are Latino women or children. And recent data show that WIC enrollment has declined over the years, which demonstrates the need to continue to raise awareness about this program among our communities, particularly those in mixed status households. One immediate opportunity we have to address this decline is for USDA to dedicate funding made available for technological improvements for outreach and enrollment to support culturally and linguistically appropriate outreach and enrollment into our communities. This would help raise awareness among Latino communities, particularly those in mixed status households, that WIC is also excluded from the public charge rule. Next slide. Long-standing barriers prevent many Latinos from participating in federal nutrition programs, contributing to high rates of food insecurity in the community. Latino children and families face multiple systemic and structural barriers to SNAP participation, including eligibility restrictions, high poverty rates, limited language access services, and inadequate community outreach about the program. Policies that restrict SNAP eligibility on the basis of immigration status, such as a 5-year waiting period for lawfully present adults, prevent many eligible Latinos in mixed status households from participating in the program. Recent immigration policies, such as the public charge rule, have contributed to a 10% decrease in eligible SNAP enrollment and a concurrent increase in child food insecurity among immigrant families. These barriers may explain why an estimated 4 million Latinos nationwide who are eligible for SNAP do not participate in the program. Next slide. That is why more work needs to be done at the state and federal level to ensure that all Latino children and families have access to affordable, nutritious food. Increased investments at the state and federal level to support an aggressive, targeted outreach, education, and enrollment campaign will go a long way to address food insecurity in our communities. Increased investments in SNAP would also ensure Latino SNAP participants receive more resources to put food on the table. States submitting and implementing their pandemic EBT plan for the 2021 school year will ensure that SNAP agencies and schools reach all eligible families. The investments that we make today to strengthen and expand and protect nutrition assistance programs will help ensure that millions of Latino children and families have access to a basic human need and a healthy future. Next slide. For more information about UnidosUS and our work on SNAP eligibility and enrollment, please visit our website for resources in English and in Spanish. You can also follow us on social media at We Are UnidosUS for more updates and information about our work on food insecurity. As a reminder, we do have a webinar next Wednesday, February 24th at 6 p.m. Eastern that will be conducted in Spanish on food assistance for Latino families. And please check out our recent issue briefs on our website that highlight food insecurity in Texas and Florida Hispanic households. Again, thank you all for joining us today, and I will turn it over to Ellen at FRAC.
Alberto, thank you so much. And next slide. We so appreciate the work that UnidosUS does and the partnership and the priority that you place on helping families meet their basic needs. FRAC, of course, we're a leading national nonprofit working to eradicate poverty-related hunger and undernutrition in the United States. And we do that through a variety of means, including research and advocacy and coordination and training, technical assistance. Next slide. Alberto's already explained to us the importance of SNAP. And of course, during COVID-19, SNAP has come in as an automatic stabilizer. As more people are newly eligible for SNAP, newly needy, SNAP is there to serve all who meet the qualifications. Everybody who applies and meets the qualifications, this entitlement program can ramp up. But there are some additional features during COVID-19, some flexibilities, some additional boost to benefits, and we have a website page at FRAC that details all of the developments with respect to COVID-19 and SNAP rules. Next slide, please. Most top of mind for us, the SNAP benefit boost during COVID-19. Alberto's already explained that a large number of people are not participating in SNAP who are eligible. This is an optimum time for them to know about these benefit boosts because it is making the equation of what does it take to apply, what is maybe some of the barriers. The barriers are worth overcoming, in particular during a time when benefits are more adequate, still probably not everything people need, but more adequate. So since last March, when there was enactment of a family's first package, we've had the ability in the country to see households on SNAP get an extra allotment. It's called Emergency Assistance SNAP, or SNAP EA is sometimes what it's called in a state. But every state that has in place a disaster declaration for COVID, as long as the federal government has its disaster declaration with respect to COVID, while those two things are in place, states can ask USDA to allow them to put more federal benefits onto SNAP cards. As it was implemented last year by the prior administration, that meant that states were allowed to bring all SNAP households up to the maximum benefit level. Unfortunately, there are a segment of the SNAP households, the poorest households, that were already at the maximum benefit level, and they have not been able to be assisted given the prior USDA policy. In January, President Biden issued an executive order, one of many executive orders he's issued, but the particular one I'm mentioning asked USDA to improve on that emergency assistance SNAP going forward. Again, that program, those benefits still remain in place, but could there be new guidance coming down that would help make sure that also needy families, even if they're already at the maximum allotment level, if there's a showing of need by the state that they're still struggling to be able to afford what they need, then there may be a pathway. So keep an eye on that. Again, that was enacted last year, and it's tied to the duration of the pandemic declarations. The second boost, and this is one that was just enacted in the end of December, is the 15% boost to regular SNAP benefits. That's separate from, but on the same SNAP card as the first one I mentioned. So January through June, again, a temporary plus up. Everyone on SNAP, every household can get a 15, and will get a 15% boost to whatever their regular benefit would have been before the emergency assistance payment was added. And then, of course, what they'll see on their card is a combination of those two. But the 15% is tied to what the regular benefit would have been in fiscal year 2021, the year that started in October and ends at the end of September. And so those are significant plus ups. I've given in the slide links to some charts that USDA has, one that shows what the maximum benefit level for households of different sizes is for January through June 2021, again, for the duration of this 15% plus up. and the other is what the benefit levels, the maximum benefit levels, would revert to July through September unless the federal government takes action, and it's considering that action, takes action to continue them longer. So keeping an eye on those. These are real dollars that are helping struggling households and are also helping the economy. Every dollar in these SNAP benefits turns over in the economy and generates between $1.50 and $1.80 during a downturn in economic activity. So next slide, please. There are additional temporary SNAP improvements, and those have to do with helping more people stay qualified for SNAP. You may recall that earlier in 2020, there was some emergency kinds of payments made in the unemployment compensation world, pandemic unemployment compensation. And unfortunately, last year, those counted against SNAP income eligibility. So some unemployed people who would have been eligible for SNAP got those unemployment benefits, and that led to their no longer qualifying for SNAP. The change in December has meant going forward, as there are these special pandemic unemployment insurance payments, they will not undercut SNAP eligibility. Households will be able to get both. In addition, at the end of December, the government has given new temporary pathways for needy college students to be able to qualify for SNAP and be considered on a basis similar to other financially needy people. We've given you links both to guidance and to an example from one of the states about how they're approaching getting that word out. As long as a college or university determines that its student is eligible for work study, they don't need to be participating in work study, but if they're eligible for it, that would be one pathway for an easier pathway to qualify for SNAP. And the other is if on a financial aid basis, if the contribution from their parent, their expected financial contribution from that parent is expected to be zero, then that's a separate additional pathway that one could use to get college students connected to SNAP. We know there's extra SNAP administrative funding that's going out to states that hopefully will improve their ability to handle cases and keep up with workload. And all along since March, there's been a temporary suspension of time limits on adults, certain adults who otherwise normally would have to show and document sufficient hours of work engagement. So these are all improvements that are in place, some very, very recent, and are going to help more people be able to qualify and show eligibility. And the next slide, please, is the last one, and that has to do with SNAP flexibilities. Again, there are waivers and uses of what I would call workarounds and options that states have been given flexibility by the federal government not to have as much red tape and procedural glitches that sometimes can keep customers from getting through and navigating the application system and being able to get their benefits. And there are links there to the types of waivers about interviews and reporting and so forth that you can keep up with in real time with respect to what your state is doing. Next slide, please. This is how you can connect with FRAC, and as I introduced my colleague, maybe we can move to the next slide because she also, I'm sure, will have information on how to keep connected with us. And so, Etienne, I'm going to turn it to you.
Great. Thanks, Ellen. That was wonderful and packed with lots of information on SNAP. And as Ellen said, there are a lot of links in there. Definitely check it out. And we'll definitely share more ways to connect with us. So good afternoon, everyone. I want to take a few minutes during my time to give a quick update on the Pandemic EBT program, also known as P-EBT. Next slide, please. So P-EBT, for those that are not as familiar, P-EBT was created in Families First, the first COVID relief package in March 2020 to provide nutrition resources to families who lost access to free or reduced price school meals due to school closures related to the public health emergency. P-EBT provides money on an EBT card to eligible students and their families to purchase food at retailers that accept SNAP. Over the spring and summer of 2020, all states and the District of Columbia and the Virgin Islands implemented a P-EBT program for school-aged children. Earlier this fall, Congress extended and expanded P-EBT to provide benefits to school-aged children for days missed this school year, as well as children under 6 whose households participate in SNAP when school or child care is closed. In addition, Congress also expanded the program to include Puerto Rico this school year, and we're thrilled about that. So who's eligible for P-EBT this school year? There are a few changes with the extension and expansion of P-EBT that I wanted to go over. On the next slide, you'll find the eligibility criteria for school-aged children, and that's going to be the focus of my presentation today. Afterwards, my colleague Jerry Henchy will share more about the kids under 6 that were included in the extension I mentioned this fall. So the criteria for school-aged children has changed a bit compared to last spring, given the different learning models schools are operating this school year. So we have many schools that are 100% virtual. We have some that are doing hybrid. We also know that some are also in person, and so we also know that some schools are operating multiple models given the grade or child. So with the changes, that is reflected in being able to capture all children that are missing school meals, whether it's due to closures or reduced attendance. So who's eligible? Any student who would receive free or reduced price meals through the National School Lunch Program and whose school is closed or has been operating with reduced attendance or hours for at least 5 consecutive days in the current school year is eligible to receive P-EBT. This includes children who are enrolled in a school that offers free meals to all students through a provision called community eligibility. If students are fully virtual, they will receive benefits for all school days that are virtual. If they participate in a hybrid model where they might be going in person for a few days and then doing virtual learning for the other days of the week, they will receive a lower benefit based on the number of days they were virtual. And I do want to flag a common question that we've been receiving, and that is whether homeschool children are eligible for P-EBT, and that is not the case. So homeschool children are not eligible. It is if you are enrolled in a school that is offering virtual learning, eligible, but homeschool not. So we did see an increase in the benefit level, and on the next slide, you'll see that updated benefit level of $682 per day. This is one of the increase was included in one of President Biden's first executive orders. The order increases it to $682, which is a 16% increase, which now includes the value of an after-school snack compared to last year. Next slide, please. So USDA released its updated guidance reflecting the changes made in the legislation just a few weeks ago. And in order for a state to provide P-EBT benefits to households this school year, the state SNAP and child nutrition agencies must submit a joint plan to USDA that describes how they will operate P-EBT. Every state, and I should emphasize this, every state is on a different timeline. So again, every state plan will look different, and every state is implementing this, at different points. As of today, we have 16 states and Puerto Rico with approved plans that are in the process of implementing the program, and then many more have submitted their plan and waiting approval, and many states are also in the process of creating their plan. We've created a map on our webpage that links to all the approved states' P-EBT web pages so that state partners can get detailed information on how P-EBT will work in their state. And I encourage you to check that out. As I said, I'm sharing the basics of the P-EBT program, but this will be rolled out differently in every state. So as you think about doing outreach and, learning more about P-EBT, it is something that you should be looking at your state's website and information on. Next slide, please. So trusted community partners were critical to letting families know about the program last school year. and know that that will be the same this school year. As part of their P-EBT plans, states have to come up with outreach plans and materials to share information about P-EBT. We've created a communications toolkit with template communications, FAQs, best practices, and customizable outreach materials in multiple languages, including Spanish, that you can tailor to your state plan to help get the word out about P-EBT. In messaging around P-EBT, we know it's been critical to ensure that families know that the public charge rule does not apply to P-EBT and that using P-EBT does not impact a parent or child's immigration status. And we've included that language in all of our outreach materials and encouraging states to do so as well. And if you're in a state that is still in the process of creating a plan, you can still start getting the word out about P-EBT. Many states will be sending a P-EBT card to the address on file at a school district. So if a family has moved, it's critical that they update their address with the school district ASAP. In addition, given the nationwide waivers that allow schools to provide free meals through the summer nutrition programs this year, many families did not complete a free or reduced price school meals application, which is one way to determine eligibility for P-EBT. So you can encourage families to complete this application now, if they haven't already done so, to ensure they receive P-EBT benefits once your state plan has been approved. We created the infographic at the bottom that outlines both of these steps, and you can find that, and you can find more in our communications toolkit. So these are just a few actions you can take on P-EBT, and would definitely encourage you to check out the P-EBT website in your state for more information. And with that, I'll turn it over to Jerry to discuss P-EBT for the young kids, and definitely look forward to taking questions in a bit. Thanks, everyone. Jerry?
Hi, thank you, Etienne. Well, hello, I'm happy to be on this webinar with all of you in the virtual audience, and there really are quite a few of you, 300 people. So I'm going to be talking, as Etienne said, about the new P-EBT benefit for children under 6. So what I'm going to do is focus briefly on answering common questions, including who can participate and when the benefits will be available. Next slide, please. So when we think about who can participate in P-EBT under 6, which is the next slide, if we think about that, all children under the age of 6 in households that receive SNAP at any time since October 1, 2020 are eligible for P-EBT benefits if they live in or attended a child care or in an area where one or more of the schools or child care facilities were closed or operating with reduced attendance or hours. So that's the kind of situation that Etienne was just talking about. So to reiterate, under 6, on SNAP, and then in an area where the schools or the child care are closed. Now, we're hoping that this will be broadly defined in most states because they do have the option to use simplified assumptions. And those simplified assumptions, for example, in some states are going to be that they're going to look at the state ordinances, which basically closed down and then constrained childcare related to COVID-19. And they're going to say, well, that means really more or less everybody's impacted by this. If they take those broad simplifying assumptions, it'll be a lot easier. Statewide, everyone will be eligible. If they go to the next level of simplified assumptions, they'll be looking at school eligibility. And just as Etienne said, that will also make things much easier. So one of the things that we're really looking at is the next slide is the question of when the P-EBT under 6 benefits will be available, right? So one thing we know is that they're retroactive back to October 1st, 2020. And that's a little different than school age because that goes back to the start of the current school year. But the actual date when people will receive the benefits is going to be based on when the states get their plans in and when they can start distributing the benefits. And how they distribute them will be determined by the state. So it could be that they'll start distributing and they'll give 3 months worth of benefits and then 3 more months worth of benefits. It could be that they'll push the benefits, the retroactive benefits in one lump. But it really is dependent on when they get their plans in and they get their plans approved and then they're able to move forward with issuing benefits. So if we go to the next slide, we'll see one of the other common questions, right, which is how do I receive PET benefits for children under 6? So for many families, the state will automatically issue P-EBT benefits on an existing EBT card with no action needed by the family. That's what we're hoping. However, in states that are still under the process of developing their plans, then we'll have to see how that turns out. But one way that you can figure that out is to look on your state's webpage for the status of their P-EBT, and there are steps that you can take to access the program. There could be some states that have application processes now who will somehow stick with those application processes. We're really hoping that doesn't happen. So if we go to the next slide. So how does my P-EBT affect my ability to receive other benefits or count against me under the public charge? And so Alberto has talked about this as well, and the answer is no, and that's the official answer. P-EBT is not going to impact public charge, and P-EBT for children under 6 is not going to impact public charge, and it's very clear in all materials, so it's an official proclamation. Nobody needs to worry, and I think that is great that we can all know that. So looking at the next slide, this is one of the other last questions that we're getting from people in terms of what would happen if they lost or they had their P-EBT card stolen. So the state can replace P-EBT cards, but they cannot replace the value of any benefits which have already been redeemed. So if you get a P-EBT card for your child under 6, and this happens with the P-EBT card, you can go to your state's webpage and figure out the contact information, and they can replace it and replace the benefits that haven't been expended, which is what you would be expecting. And so if we go to the next slide, we do have this specific resources as far as trying to help get the word out about P-EBT for children under 6, and this is under the links which Etienne went over in terms of our resources, but this can help you explain it to people because it goes through all these commonly asked questions. So if you have questions yourself or you're doing outreach on this, please make use of this fact sheet. So that's it for our presentation on P-EBT, and now I have the privilege of turning it over to Maria Pinson.
Good afternoon. Good afternoon, everybody. It's great to be here. My name is Maria Pinson. I am the Executive Director of Hispanic Services Council here in Tampa, Florida. Our mission is to increase access and opportunities for Latinos and influence the systems that serve us and the community we serve. I am hoping that with all the information you've already received, that I am able to give the boots on the ground perspective, particularly focusing in on our community health workers or our promotoras that have the incredibly difficult job of relaying all this information to our community who is primarily not, limited English speaking or non-English speaking, and who definitely need connections to resources. Next slide, please. So as you can see from the statistics, I won't go over all of them, but you can see that food insecurity certainly existed pre-COVID. There is no doubt that COVID clearly demonstrated the disproportionate impact on communities of color, in particular the Latino community. When we have children living in poverty, 21% of them, also 51%, as you see, living in low-income households. This is aggravated, as Alberto mentioned, in the sense that we have many of our children, 91% of them who are citizens, are living, almost the majority of them, 49%, living in mixed income households, and mixed status households, excuse me. And what we're seeing is that compounded with the fear and the misinformation that's going out for various reasons by various outlets, this certainly aggravates the issue of food insecurity for our community. Next slide, please. What we are seeing is that food insecurity is right now not only a policy issue for us, but it's certainly clearly highlights the intersectionality of the issues of access, of cultural competency, of linguistic abilities, health, and of course, economic stability. We see here that we have children in Florida, 20% of them at least, who have reported, whose families have reported that they do not have enough food to eat, at least in the past 7 days. A grave situation. And when we look at the issues of fear, as well as the issues of not understanding that they are eligible or not wanting to participate because of the public charge issue, this number and this percentage clearly rises. Next slide, please. What we know through our community health workers, our promotoras, is that, as Alberto mentioned, the barriers to participation in SNAP, in WIC, and all the benefits that are available are many, are varied. And they do start, of course, with the limited English ability and to access services. But we're also seeing, as many of you have seen, that technology plays a great barrier in this issue, with many of our communities not only not having computers, but the computer literacy, let alone all the connectivity issues that we've been faced in the recent months due to the pandemic. We also have, and I have to reiterate the immigration concerns, the issue of public charge and the misinformation about it and what it means and what it does not mean and what you can apply for and be eligible for is still a big issue for our community in terms of wanting to or being able to or applying for these, knowing that they're eligible but very scared that they will suffer consequences, particularly in that. This all is about community outreach, and it is about giving correct information. And it is about not just doing it in words, in paper form, but definitely using trusted messengers like our promotoras. And I'd like to talk to you about that. Next slide, please. Because they are the trusted messengers in our community. Without the promotoras, which means promoters of health, we would not have been able to reach as many individuals who need these services and who can access these services. So what we're seeing here in Tampa, Hillsborough County area, is that certainly the issue of the food insecurity is increasing by the day, not only by low income individuals or unemployed, but certainly, as many of you have seen, those that are employed but are seeing that the dollars just don't match. The increase in participation in food pantries is huge, but certainly what we've also seen is the barriers within the food pantries and food distribution sites in terms of the lack of bilingual ability in many of them to be able to serve the community that goes to them. And we, the promotoras, note that as we're trying to promote healthy eating, and certainly SNAP is one of those vehicles that allow for choice in what our families choose for their families in terms of healthy foods, the lack of healthy foods in many food banks is an issue for us as we try to control obesity, as we try to control chronic diseases in our community. Thirdly, in terms of participation, the lack of cultural competent or culturally relevant food for our communities leads to not only waste, but certainly continues the food insecurity because we're not seeing people using the food that they're getting. That's why our promotoras pre-COVID would be able to speak to our food pantries and develop a recipe, a healthy recipe from the food that would be distributed that week. That has stopped because of COVID, obviously, and so we're hoping to get back to that, but that is something we're working with our food banks to see how we can incorporate culturally relevant food. Also, we're seeing the lack of transportation as a major barrier. We're seeing that, walk-ups are not allowed in drive-through food distribution programs, and we're hoping and advocating that families who do have a car would be able to pick up from more than just one family and how to be able to access that ability to do that. where the timing of these drive-thrus also has been a major barrier, particularly for our farm worker families who work from sunup to sundown and do not make are not able to be arrive at the food distribution times that they have. And also, we know that there are some food banks and some distributions that are asking for Social Security numbers, which certainly impacts the ability of some of our families, and we're advocating for the use of the children's Social Security in order for them to do that. The promotoras are a tool, an incredible tool of trust, because this information that has been described today will not reach our community, will not be understood by our community if it's not given by trusted messengers. And of course, we have to know that we build the capacity of our promotoras to understand what are these policies that are coming through so they correctly impact the community. We know that the technology, as I mentioned, is a huge barrier, but it is the promotoras who go to the homes, who go to where the community is, to be able to use the technology that they have in order to access those benefits for the community. As I mentioned, it is important that while we talk about food insecurity, that we also talk about how to make sure that they continue to eat healthfully. And so part of that is the cooking classes that we offer and the health literacy classes that we offer to connect them to the resources, to help them better understand how to use the health insurance that they may get through the application assistance to health insurance options that the promotoras do. But it is important that education is combined with all the policy advocacy that we're doing, because dispelling the myths and building the trust of the community is key for participation in so many of these needed benefits that our community is fearful to participate in. And I welcome any connections to me. My email address is on the screen, and I look forward to your questions. And thank you so much. And I pass it on to Alejandra for questions.
Thank you. Thank you, Maria. Thank you to Jerry, Alberto, and Ellen. Fantastic presentations. We have a really busy Q&A, a number of all excellent questions. Let's start with the public charge because the ruling inflicted a lot of not only pain in individuals and families, but also created all this environment of uncertainty. So one of the first questions is for someone who recently married, she lost her job. Her attorney advised her that applying for the SNAP would most likely be public charge. The question is the SNAP considered public charge? Ellen or any of you?
So I think Alberto probably has more to share on this. We are very careful in talking about SNAP and public charge to say that it could be a consideration, but it is going to be for a small segment of people who are non-citizens, that it should not come into play for most, but we defer to people getting information about their particular individual circumstances rather than try to give a legal opinion. We do know that lawyers try to be very careful, as they should be. I'm a lawyer. But sometimes lawyers are very versed in certain areas of the law and may not understand the public benefits area of the law as well. We think that legal services attorneys often are the ones who work in both worlds and may be able to understand best how these things work. But I think we have a link to some information from Protecting Immigrant Families, which is a coalition that our groups are very involved with and proud to be a member of. And one of the things that we'll have to keep an eye on is that public charge is not a static policy right now. there's a lot of improvement coming out of the new administration with respect to rules on lots of things, and we're waiting to see what the developments might be with respect to public charge. So, Alberto, I don't know if you wanted to jump in, or if we've had a chance to share that Protecting Immigrant Families link, which does have information in lots of languages.
Yeah, I would direct participants to go to that website to learn more about which programs do or wouldn't fall into that category. And just to clarify that, federally funded SNAP benefits may be considered in the public charge determination. But as Alan mentioned, there are a few individuals who are eligible for SNAP, but who are also subject to the public charge determination, and making it clear that other family members' use of benefits does not affect the immigrant. So just want to make that clear, and again, direct folks to the Protect Immigrant Families website. And I do want to mention that there are a number of states that actually have their own, that do provide food assistance benefits to people regardless of their immigration status. So I would definitely refer you to their state SNAP website. So this is California, Connecticut, Illinois, Maine, Minnesota, and Washington. And these are where no children are subject to a waiting period to establish eligibility for SNAP. So I'll list these states in the chat, but I encourage you all to learn more about this information from your state SNAP agency.
Thank you, Alberto. A follow-up question to the public charge question is, if someone lost health insurance due to job loss, what places the person, individual families can go for dental and health services that would not be considered a public charge? I'm happy to take, I think Maria or you, Alberto, but also I'm happy to take that question.
Go ahead, Alejandra.
So there is a number of federally qualified health centers located in different parts of the country where you can access dental and health care services. To my knowledge, accessing dental and health services is not considered a public charge, but I'm going to let the attorneys panelists on the call to answer that. So if I were not to have health insurance, that is the place I would go ask. There are differences across states, so depending on the state where you are living, there are federally qualified health centers. If you go to the UnidosUS website under affiliates, there are a number of all of our federally qualified health centers are listed there. So that would be a place to go ask in your local jurisdiction, a community-based organization where you can seek dental and other health services. They want that.
Alejandra, I just wanted to add, I apologize, that certainly the federally qualified clinics are a place to go. The greatest fear is that communities do not access dental and health services because of that fear, that there are free clinics. Certainly there are, the QHCs that help out, and it is just imperative that they seek out those resources, as well as resources not only with immigration attorneys, but with nonprofits who have been recognized by the Department of Justice to offer immigration legal services. Like we are at Hispanic Services Council, and our staff that is accredited acts, they are able to provide immigration legal services, can answer your questions as attorneys, and we charge a nominal fee. But the most important part is how to be able to communicate that our community, that we need to, they need to remain healthy and protect their children, and do access. There are services that will help you to clarify and to be able to receive those services.
Absolutely. Thank you, Maria, for that clarification. The role community-based organizations play is critical at all times, especially during these times. Another question has to do, there are several questions around P-EBT. To get P-EBT, for example, do people, children have to be, okay, does P-EBT include the students enrolled in private schools? Etienne, can you answer that question?
So if Etienne can answer it, I will. No, it doesn't matter if they're in private schools or regular schools. All the children who are school age will qualify.
So the follow-up,
if they are in age that qualify.
Thank you, Jerry. A follow-up question to that question is, do you have to be enrolled in a SNAP to get P-EBT, even if you receive free or reduced lunch?
So for school-age children, you don't have to be enrolled in SNAP. For children who are under 6, you do have to be enrolled in SNAP. And that's what's different about it. And we actually don't like that about the benefit for children under 6. It was originally much better, but by the time it was done, it was narrow and focused on SNAP. The only thing I can say about that is that if, as Maria was saying, if the children in the family are eligible for SNAP, you could enroll them in SNAP, and then you would also get these P-EBT benefits retroactively.
Thank you, Jerry. Another one, some Latinx families are having a difficult time applying and receiving their first P-EBT card. Is the help retroactive?
Yes, it's retroactive. Oops. Yeah.
Yes,
ahead,
sorry, this is Etienne. Sorry, I wasn't able to unmute myself for a bit, so apologies for those tech priorities. And I would also just want to flag that the application is so many states have it that it's direct issuance, and then there are many states that do have an application, and we have heard that families have had a hard time, so benefits will be retroactive to the beginning of the year.
Excellent. How can we find out what individual states are doing for P-EBT? Do you have links to the pages per state?
Yes, we can pop it. So one of the links is in the PowerPoint, and I know we're going to be sharing that afterwards, but if you go to frac.org/PEBT, we actually have a link to, we have a map that includes all of the approved state plans, or all the approved states, their PEBT websites, and that's where you can find more information on how it will be implemented in your state. And like I said, right now, we only have a handful of states that do have approved plans, but we are constantly updating that. So once your state plan is approved, it will be included in that map and the link to more information for families.
Thank you, Jan. This question most likely is for Maria or Alberto, or any of you. What advice do you have for helping patients who are not accessing resources they are eligible for due to concerns of public charge? Maria, what would you say? Or Alberto?
That's a tough one. I think they, our promotoras face this every day, and I think the main issue is to calm their fears, to ensure that this what they need to access, especially if it's for children, they need to access these for their children, for the sake of their children. I do feel for these families who are just so scared. But I think that the message needs to be consistent, and it needs to be given by trusted individuals in the community, helping to build the leadership within community members of the trusted individuals to be able to have a consistent message that is true. I think it's you just need to continuously inform them and let them know that this is for the sake of their children and the health of the whole family.
Yeah, so living with fear, it's something impacting many families. That's why the role organizations like Hispanic Services Council, where Maria is the executive director, are just so relevant. It's a process. There is a follow-up question. Again, going back to SNAP and eligibility. This person is a U.S.-born citizen, but she married a national from Mexico. I lost my long-term employment. I do receive unemployment. SNAP would help me, but I do not want to impact our process in the eyes of the immigration official when we go for our interview. What would you say, any of you?
I'm not sure where you live, the person who asked the question, but I cannot encourage you enough to seek out legal help, particularly from if you have, again, a nonprofit in your organization that does have immigration legal services, and ask them for that question. Feel free, of course, to contact us in Tampa, but we certainly can connect you to our immigration legal services staff that can give you more information. But it is important also that you access the services that are in your area in the meantime to make sure that you are safe, you are healthy, and that you are well.
Thank you. Last two questions. Does money on a SNAP card cross state lines? In other words, can a SNAP debit card be used out of state?
Yes. Yes. One of the beauties of SNAP electronic benefit transfer cards, EBT cards, is they work in so many places, and it doesn't matter what state you're using it in. They work the same way across the states, and in so many different food retail settings. You know, everything from big stores to smaller corner stores to farmers market, and increasingly now the availability of online SNAP ordering with the card and pickup and delivery. So that's one of the very positive features of the program.
Okay. Another question, maybe, Maria, you can expand on this. They would like to know about efforts, communication efforts about the benefits of these efforts in the Latino community. Perhaps you can address what we are doing with Comprando Riquisano.
So Comprando Riquisano is a program with UnidosUS that uses the promotoras to be able to help the community understand and practice how to stay healthy. So the part of the components are grocery store tours that help our community better understand how to read a label and be able to shop, healthy on a limited budget, as well as having healthy conversation circles or charlas that help people better understand just what being healthy is about, and the fact that we also need to value the health beliefs and traditions of our community in terms of how they take care of themselves and how health is more fully defined and culturally defined by our community as well, and that the primary purpose of Comprando Riquisano is then using that knowledge. We have our promotoras help individuals apply for SNAP, ensure that they're eligible, and be able to enroll the families at mixed status as well as families through their children to apply for SNAP, because that is a benefit that they are eligible for. So it's about education, it's about building the trust and building their confidence and keeping their families healthy.
Thank you, Maria. There are two questions. I don't know if we can stay on the line for a few more minutes. Would that be okay? There is a question for Ellen. Do you know how the 15% increase in the food share allotment that runs from January to June was determined?
That was just what policymakers felt would be what they had the money and felt the political will to do. It certainly, we know there's good reason why there was an increase enacted, and that's because so much research, so many surveys have been done during COVID-19. It's not just the anecdotal evidence through the food bank network where we know people are struggling to afford food, but through surveys, the Census Bureau surveys every week about food insufficiency. There are other surveys that have been going on. We know that users of an app, SNAP customers who use an app called P-EBT, they've been surveyed, and even with some of the boosts and benefits during COVID-19, they're reporting struggling affording basics, including affording enough food. So we know it was necessary. Whether it's sufficient is a different question, but it's going to be an important boost. It's rolling out a little differently timing-wise, state to state. Some states got the January allotments out very quickly. Others are moving January and February together. But again, a lot of times what ends up happening in policy is some of it is well informed, and some of it's guesswork, and some of it's just, well, this is how much money they decided they would allow for this.
Thank you, Ellen. The last question has to do with the two, Ellen, perhaps you, what are the two new pathways for needy college students?
Okay, so these are really important because in normal times, there's a terrible feature in SNAP which treats college students as if they're not working hard enough and they have to demonstrate that going to college is not just some lifestyle choice. And they're required normally, with some exceptions, they're normally required to show that they're working in work study or sufficient hours in a private job or public job. Of course, life has disrupted things for people in COVID. We know that many college students were struggling with hunger even before COVID, and that bar made no sense. During COVID now, these new pathways will allow the student to be considered the same way other applicants are. In other words, we're not going to care if you're performing work study as long as you were financially eligible for work study, and that's a decision that your university or college makes. So that's a very good way to think about that. And the other is that if you're financially needy, one of the indicators that is going to show that to the state when they're processing is that your parents are not expecting to be financially paying for you for your education. It's a measure within the higher education funding world called expected financial contribution. And the links in the PowerPoint will provide you with much more detail, but especially very good practices and lessons learned early on out of Massachusetts with a letter that's very proactive at reaching out to the student community. A lot of work that's going on between the SNAP agencies and their higher education agencies and the advocates to help get this important word out so that we can meet the needs that so many college students have, particularly during COVID-19.
Thank you, Ellen. There are more questions which we won't be able to answer on air, but we'll reach out to you, especially to the person from Texas asking whether we count toward a SNAP. And I don't know if that is a quick answer, Ellen.
I'm sorry, I missed the question.
Does we count toward a SNAP and Medicaid income? And she's in Texas.
It shouldn't matter, I don't think. I'll double check that for you, but I don't think that would matter.
Okay, thank you. So thank you to all our panelists, Alberto Gonzalez, Ellen, Etienne, Jerry, and Maria Pinson for wonderful presentations. Most importantly, thank you for making this a lively webinar. We encourage your questions. We know there is a ton of work to do at the national and at the state level. A couple of call to actions. First of all, call on federal and state policymakers to adopt policies that attempt to address food insecurity among Latino children and families. We all have a role to play in this. Encourage members of the Latino community to apply to a SNAP. Comprando Rico y Sano is implemented in 27 communities across the country. Tampa, where Maria is one of the 27. If you go to our website, or if you contact me, I'd be happy to contact you. On the 24th, we'll have a webinar just like this in Spanish. I encourage you to ask your families or providers to join us, and we'll facilitate that in Spanish. And lastly, by no least, go to UnidosUS website, go to FRAC website for more information, and so that you can help those who are serving. Again, thank you. Have a great afternoon, and I hope to see many of you on the 24th for the Spanish version. And that webinar is scheduled in the evening between 6 and 7:30. Alberto?
Yes, that's correct, Alejandra. 6 to 7:30 next Wednesday, February 24th at 6 p.m. Eastern.
Exactly, Eastern time. Have a good afternoon, everyone. Stay warm. And our friends in Texas, I hope that you get the power soon and be safe. Take care. Bye-bye.